Sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
It's the latest health fad making the rounds online. It's called oil pulling. We've been chatting about it on the show. Our health specialist Leah Sarich is here now with whether this trend will actually whiten your teeth and give you clearer skin. So talk about what this is.
Yeah, so first of all, what is oil pulling? So as you mentioned, it's been getting a lot of press lately, particularly in the social media atmosphere, because Gwyneth Paltrow mentioned it a few weeks ago, and you know, exactly, on her Goop site. So oil pulling is actually an ancient tradition, so it's over 2,000 years old. And it's a tradition where you're swishing oil around in your mouth, and back then it was used for oil hygiene purposes, so to clean your teeth. So basically what they've done, though, is they've expanded this idea now. And so they're saying there are many other things that oil pulling is doing, much more beyond oral hygiene. So I spoke with naturopathic Dr. Beverly Huang about this.
The claims behind oil pulling include anywhere from whitening your teeth to reducing bleeding gums, even to improving your complexion, or also detoxification as well too. So one of the more common oils that people are using is coconut oil, and coconut oil itself has lauric acid in it, and lauric acid has properties that are antibacterial, antifungal, antiviral, and a lot of these properties is where it's being applied to the oil pulling process.
So there you go. So you're swishing it around in your mouth. Now the general technique is to swish it around, the coconut oil around in your mouth for about 20 minutes every day. Now,
that's a long time.
It's a really long time. And I was like, really? But the trick is this, and I didn't realize this at the time. You only do it about 1 tablespoon at a time. Because basically when you put coconut oil in your mouth, exactly. When you put a tablespoon of coconut oil in your mouth, it's kind of in a solid form. But then it's going to melt when it gets in touch with your saliva. And here's the best part. Then it's going to double in volume.
Oh, fantastic.
In your mouth.
Okay, so it gets all kind of big.
So it gets kind of crazy town in there, yes. Now, and then when you're finished, you definitely don't want to spit it down the drain because it will then solidify again in the drain when you're finished.
So you need a spittoon
to do
this. Okay,
yes.
So you are our health specialist.
Yes.
You would never just leave it at that.
No.
The question is, does it actually work? Do any of these properties?
Well, the bottom line is we don't have the evidence, right? That's the bottom line. This has not been tested in any clinical trials or anything like that. However, I did ask Dr. Huang about this, and she said, you know, it's all about that lauric acid that she was talking about that's actually in coconut oil. And she says there is already a little bit of encouraging evidence.
Recently in Toronto, a dentist there reported that she did an informal trial at her clinic with her practice with a group of patients. And after 3 weeks of oil pulling, she found that all of her patients seemed to have glossier, whiter teeth. As well as, importantly, it also showed that she found a reduction of 2 loads of different types of bacteria that can cause cavities, as well as a reduced load of yeast in the mouth, which can lead to oral thrush. So it gives an early indication that I think it's the coconut oil in itself, because of those antimicrobial properties, that is lending towards the oral hygiene in terms of reducing the bacteria and improving your oral health in general.
So there is something going on there, but of course that was just for the mouth, just for the oral hygiene purposes. So I asked her, so are you going to recommend this to your patients? And she said no, she is not. But the reason being, she simply doesn't have enough evidence to suggest this on a grander scale. And she says in general, a lot of these health trends will come and go, and she's really just looking for more research or more evidence of what they do. So she said there could be some benefits to the oral hygiene part of it, but as far as the stuff that talks about clearer complexions and detoxification and the helpful migraines and asthma and all the other ones, she said there's really no evidence to do that, and I wouldn't be comfortable recommending it.
Okay, so. But if you wanted to check it out for yourself.
Yes, there are a few things to consider. It's not going to hurt you.
Yep.
So if you want to give it a go, it's not going to be a problem. Make sure you use organic, cold-pressed, virgin coconut oil, because that will have the highest level of that lauric acid that we were talking about, so it has the best chance of really doing something. And then the other thing, make sure you distract yourself while you're doing it, because 20 minutes is actually a really long time. So she's like, check your email, go online, read a book, do something like that, watch some television, and do be careful not to inhale it. So just keep that in mind.
Okay, you know what? I have friends who swear by it, and it's 2,000 years of Ayurvedic medicine.
That's right.
It might be something to it. So check it out. If you've checked it out, let us know.
Exactly.
On your blog, more information.
Absolutely, it's all on my blog.
BreakfastTelevision.ca. Health specialist Leah Sarich. Thank you for that.
You're welcome.